Now, how important is it to really pay attention to when you need to go in for hygiene checks or into your next patient? Would you frequently make your hygienist or your patients wait a long time?
Yeah, so the exam note system kills that problem. If you don't know what that is, then clinical efficiency module, there's one on the exam note system. It talks about that. I want to know where I need to go at any given time, way before I need to get there, right? So when the hygienist is ready, I feel like you have something that you want to add there.
No, I'm
Okay.
good.
So once the hygienist has the x-rays taken and I could go into the room, I want that exam note. And there's a process for it. I won't repeat it. Go watch the module. It's there. It's crystal clear. But I want to know. And if I'm doing a longer appointment and I turn around and I see 5 of them behind me, fine. I know I have 5 places I need to be sometime in the next half an hour. But they're not at the minute they need me, because the exam note tells me I need to be in by a certain time, which is 5 minutes to the end of the appointment, so I don't ever make them wait. Because if I put them behind, then it cheeses off the next patient, and I set the hygienist off for an entire day of bad experiences because now they can't catch up, right? So I just quickly organize them as, what's the next one? Okay, so I got to be out of here in 10 minutes. The last one I've got 30 minutes for. So I got to find a way to exit, or I got to be done. Now, sometimes I can't finish, but I can say, okay, I want you to cure the proximal surfaces of all the teeth we worked on, and, go slowly to make sure that we don't overheat the teeth. Like, I just come up with stuff, like, and the assistant can sit there and fool around with the curing light and, 5 seconds here, 5 seconds there. Like, don't cause damage. Like, they would understand how to do that, and then we just talk with the patient. So they could buy like a minute or two with the curing light, and then they could just talk, and I would just go do the most urgent one. Come back in, keep going. And then when I'm done, I would have an order. So I would know exactly where to go so that I wouldn't put people behind. It was a game all day to not put a hygienist behind, because that means I got to hurry up. The hygienist wants to hurry up. It's harder to present treatment because everyone's in a hurry. You kill the experience if you're late. So you kind of want to be there when you need to be there. Again, it comes back to the previous question when we talked about hurrying up. Like, if it takes you forever to do something, then you don't have the time. If you can get it done. So here's another thing. If I have an hour for something and I really only need 30 minutes, will I spend the hour? For me, this is something, you'll laugh when I say this, but I would rather have the time at the end than dawdle at the beginning knowing that I have the time. Because inevitably, something comes up that I need the time at the end, but now I don't have it, right? So that's how I approach it. It's like, okay, we're supposed to start at 9. I only need till 9:30, but I have till 10. Let's start at 9 and hurry up. Why are we hurrying if we don't have? No, we get it done the same way we always do it, because at 9:30, eventually, inevitably, here comes the hygienist, needs checks. Here comes something that needs to be done. Here comes something else that needs to be. You always have a use for the time. But if you look at the clock or look at the scheduling and say, well, I have an hour, you'll find a way to make an MOD take an hour. Like, don't do that. Get it done and have the time at the end. Don't burn the time at the beginning, because then you're rushing. Yeah.
I do remember. It's true.